It's my pleasure to be here at the Baptist Health International Symposium.
You've got a great program ahead in the course of the next couple of days. You're going to be able to hear from some of the most preeminent physicians in the country.
Baptist Health's mission has always been about more than medicine. It's about compassion, innovation, and collaboration.
Every year, we welcome patients and their families from around the world to Miami to benefit from our medical expertise.
This has been a dream that actually came true after so many years of actually planning.
I think I would describe it as a multi-specialty, innovative symposium.
We thought about how we wanted to put together a day and a half of symposium modules that would feature our 4 institutes. We had 198 attendees, 115 flew in from 17 countries. And then we had 26 obvious speakers.
Médicos que hemos traído de aquí, de todas partes del mundo, que son eminencias en su especialidad.
The first part of the event is obviously the clinical education is the beginning of the conversation. But out of that starts the second part, the relationship.
We're doing some of the most state-of-the-art things in all of healthcare, and to be able to not only share that with physicians around the world, but also create a collegial environment where we can all discuss cases and continue to follow up with each other and continue to stay in touch with each other is very, very important.
Medical information is changing at a rapid pace, and you really need to stay abreast of all the newest technologies and everything that's around the corner to give the best care for our patients.
This is why we have these symposia and these meetings, and it's critical for everybody to update yourself on a regular basis.
That's how we grow. We grow through relationship. We exchange ideas, we learn from each other, and we get better at what we do.
With our location in Miami, we're well poised to serve not just South Florida, but an entire community in the Caribbean and Latin America.
The wheels are turning in my head because I have patients that I can think about already that I can refer to Baptist Health.
On a very personal level, people feel exhausted when they reach complex diagnoses. If you can give someone an option, for the patient, it obviously gives them an opportunity to hear from someone else. It also helps at the level of the physicians because we can also feel less frustrated. We can get someone service if necessary.
I find that I was thinking about those cases because Baptist Health has provided us the opportunity or an avenue by which we can actually serve those clients.
Este año tuvimos un paciente muy especial. Se le rompió un aneurisma de la aorta del corazón. Y un médico que es muy bueno en Guatemala le puso un clip y le salvó la vida allá. Pero ya allá no había más que hacer. Entonces comenzamos a trabajar todo lo de la ambulancia aérea.
He came here, I took him to the operative room right away and did a very big operation, including replacing all of his aorta, all his aortic arch, arteries going to the brain. Did very well after the operation and went back to Guatemala.
Y el paciente está perfecto, bien y súper agradecido con Baptist.
There was one lecture on the first day about people with essential tremors and some of the new and novel ways that we can be treating them outside of the pharmacological treatments. And there's a gentleman back in Cayman who's an artist whose obviously life and his career is debilitated by having a tremor. So he's one of the first ones I'm going back to.
He tenido la oportunidad de tener varios pacientes acá. Quería conocer a qué servicio van, cómo funciona el hospital en general, cómo es la logística de traer un paciente acá, etc.
Para mí esta experiencia ha sido muy gratificante debido a que me llevo el enfoque humano.
Después de vivir esta experiencia me queda la paz mental de que todos los pacientes que nosotros mandamos van a ser referidos al equipo correcto y no solamente eso, sino que también tienen acceso a la mejor tecnología que está en el mercado.
Yo fui paciente y soy paciente de esta institución. Como vi ese trato tan humano, ese personal, yo me sentí como si estuviese en República Dominicana. He referido como 2 pacientes con cáncer de mama y es porque realmente me sentí muy bien atendido.
We do have the communication through our language. Hablamos todo español, algunos hablamos un poquito francés, and we all speak English, of course. So that's a very great way of communicating with our patients.
And really patients love our warmth, our approachability, and our spirit.
I think if we continue along the same path, I think we're going to see a bright future here.
It's our great honor to be one of the leading institutions, especially when it comes to neuroscience. We are now world-class and ranked number 39 in the nation.
El nuevo edificio que vamos a tener aquí para el Miami Neuroscience Institute es algo muy importante para nosotros. Con más doctores también podemos ver más pacientes de otros lugares.
We're really looking forward to continuing to grow in addition to the new building that we're currently in the process of building for Miami Neuroscience Institute.
Welcome to the Future of Women's Care in South Florida at Miami Cancer Institute.
And this is Florida's first and only dedicated center to women's health,
where we can provide the best standard of care to our patients, not only here in South Florida, but patients who come from overseas. So as we expand the different institutes that we have, we will see a conference that is even larger than what we have.
You know, sky's the limit. Baptist Health International is growing. We had our second best year in the history back to back. And so from our CEO down to everybody else, they believe in being a global institution.
And we are happy to participate in anything that we can do to make this event bigger and better.
We are planning on having it every year. We already have forecasted for the next 5 years, so more to come.